In this video, I will share the 5 biggest mistakes I've repeatedly observed in those who failed their internal medicine board exam, so you can avoid these pitfalls and stay on track to pass. And to give you some perspective, I passed the ABIM board exam twice, initial certification and recertification, scoring in the 90th percentile each time. I've also mentored dozens of residents, both first-time takers and those retaking the exam, helping them succeed. So let's get started with the first mistake. Using Q banks to learn instead of to test. Just last week, someone reached out to me because he felt unprepared for the exam, and it was only a few weeks away. When I asked about his study method, it turned out that he was relying only on question banks. Now, Q banks are fantastic for practice. They help you rehearse the exam style questions, build endurance, and sharpens your test-taking skills. But here's the trap. If you only do questions, you will miss the deeper why behind the answers. The boards are not just testing recall, they are testing your reasoning process. A better strategy is to learn the high-yield content first, then use Q banks as a checkup to test and reinforce your understanding, not to build it from scratch. Mistake number 2, picking too many sources. Starting with MixApp, then someone tells you about mid-study, then a month later you heard about board vitals, and before you know it, you are juggling 5 resources, spreading yourself thin and feeling overwhelmed. The solution here, choose one primary resource and commit to it. Depth always wins over distraction. As of which course to pick, that depends on your learning style, your strengths, and your weaknesses. It should be tailored to you. There are different board review courses out there, including one I'm currently working on. Mine is not ready yet. It will take a few more months before it's available. But the key is the same. Find the source that fit your style and needs and stick with it. Mistake number 3, treating all topics equally. One of the biggest time wasters is giving all topics the same weight. For example, spending days on vasculitis while skimming over heart failure, pneumonia, or diabetes is not a winning strategy. The board exam does not treat all topics equally, and neither should you. According to the ABIM blueprint, cardiology, pulmonology, infectious disease, GI, endocrine, and rheumatology together make up nearly 2/3 of the test. Master these and you have already stacked the odds in your favor. Now here is where strategy comes in. Have you ever heard about the 80-20 principle? It is the idea that in many areas of life, a small portion of effort produces most of the results. Like 20% of your patients accounting for 80% of your clinic time, or 20% of clothes in your closet being worn 80% of the time. Applying this principle to board preparation, it's not the exact math, but the message is focus on the core high-yield topics that keep showing up, and you will capture most of the points that matter. Study smarter, not harder. So instead of trying to memorize every rare syndrome or obscure drug interaction, you focus on the bread and butter topics that actually determine whether you pass or fail. Mistake number 4, not planning the exam day strategy. Most people underestimate how much test day logistics matter. Even if you know the material cold, the exam can trip you up if you are not prepared for the experience. Poor pacing, skipping breaks, or eating the wrong thing at lunch can derail your focus and cost you points. Do at least one full practice block under time condition so you know your natural pace. Map out your breaks, pack your snacks, and plan your hydration. Treat the exam day like a marathon, not a sprint. Your body and brain need fuel to perform. Let's move to the last mistake, which is last-minute cramming. We all know cramming does not work, yet almost everyone is tempted to do it. The problem here, trying to learn everything in the final week usually backfires, leading to stress, burnout, and worse recall on test day. A smarter approach, use the last week for focused refreshers, review high-yield topics, run through key algorithms and tables, and do a few practice questions just to stay sharp. And here is my personal recommendation. Stop studying 18 to 24 hours before your exam. At that point, rest is more valuable than information overload. Give your brain space to consolidate what you already know so you can walk in focused, calm, and ready. In the end, knowing the mistakes is just the beginning. In my next video, I will share a readiness self-assessment scorecard, a simple way to objectively measure whether you are actually ready to sit for the exam this year or not. And if you discover you are not as ready as you would like to be, don't worry. I will show you what the next steps can look like. Stay tuned for next video. Thanks for watching, and I'll see you soon.